How's it going, guys? We have a pass level question for Neuro for Step 1, Internal Medicine, Family Medicine 2 CK. You've got a 33-year-old woman who has restless leg syndrome. Okay, we're not being confusing about that. I just decided to be an asshole, throw in this weird sentence about textile factory, industrial dyes, not related. Okay, aniline dyes, that could be transitional cell carcinoma of the bladder. It doesn't even remotely relate to this vignette. And then normal diet, many ice pops. What's the most appropriate next step management? Should I say Baclofen? Wrong fucking answer. It's a high yield drug for USMLE. You gotta know the mechanism of action. It's used to treat spasticity. Oftentimes, a multiple sclerosis could be used outside of that condition as well, but it's a GABA B receptor agonist. Okay, it's not dramatic. They can be a little bit tricky with the question. Give you a question with MS. Patient's got spasticity, and they're like, "How do you treat the spasticity?" And they're like, "Which receptor are we going to be acting on?" And the answer is GABA. And some students think, oh, it's like muscarinic, nicotinic. They throw all the different receptors in there. Wrong fucking answer. Choice B, gabapentin, wrong fucking answer. So this is what's going to go down, okay? Some students getting emotional about OMG, potentially updated guidelines where do we now use gabapentin before dopamine 2 receptor agonists such as pramipexole, ropinirole for the treatment of restless leg syndrome? Okay, traditionally, D2 agonists are how we treat restless leg syndrome. Gabapentin, I mean, do we use it first line now instead? USMLE is not going to play trivia that way, okay? They're not going to do this and force you to choose between the two. And this isn't my opinion. I've seen it on one of the NBME forms. What they're going to do is say, in addition to gabapentin, which the following is the most appropriate next step in pharmacologic management? And the answer is just ropinirole or pramipexole. Gabapentin, wrong fucking answer. Choice C, iron studies, correct answer. Now, you got to know that the most common cause of restless leg syndrome is iron deficiency anemia. Woman doesn't have to have heavy menses either. I could have thrown in her menses are normal, not heavy. I've seen family medicine forms where they say that, and the answer is still iron deficiency anemia, very common in women of menstruating age. So answer can also be just check serum iron and ferritin, same thing. So once you determine that the iron studies are normal, which by the way, the consumption of ice pops, this is pica or pica. Okay, so I try to be more discreet about it rather than like hyper obvious she's eating clay. Okay, so clay, cornstarch. Okay, these are items that are fomites. Well, not a fomite per se, but typical non-food items in their current form. Pica, okay, and it's reflective of iron deficiency anemia. So you're gonna do iron studies first, and then if they come back normal, then you can do gabapentin followed by pramipexole / ropinirole. But as I said, don't flip out about is it going to be gabapentin or pramipexole / ropinirole if we're forced to choose between the two. Urine serum toxicology, wrong fucking answer. Just obvious miscellaneous distractor. If you got pulled, I don't know, the 6% of you that got pulled into this textile factory nonsense. Toxicology, wrong fucking answer. You know the deal. I'm to make more content. You like my stuff, scrum and channel. Appreciate your time. That's it.